So many people struggle with hyperpigmentation and wonder what are some scientifically proven ways to treat it. Hi, I'm Dr. Crystal Agu, board-certified dermatologist and medical advisor with FemHealth, and we're going to talk about hyperpigmentation. If you enjoy this video, be sure to tap subscribe below so you don't miss our completely free content teaching you everything you need to know about women's health. Hyperpigmentation is one of the most common skin complaints seen in a dermatology office, particularly among women with heavily pigmented brown skin. This is because melanin is naturally produced in response to skin trauma or damage. For example, whenever the skin is traumatized by the sun, or someone experiences a bug bite or an acne pimple, it triggers the skin to produce excess pigment to protect everything lying beneath the skin surface, particularly our DNA. The upside to this reaction is that those with high levels of melanin in their skin are less likely to develop skin cancer. The downside of this response is that the skin becomes more easily discolored as a response to everyday inflammation. For this reason, women with brown skin can struggle with keeping the skin evenly toned. There are many different treatments available to treat hyperpigmentation, such as chemical peels, topical bleaching agents, as well as exfoliating agents, which increase how quickly discoloration fades without bleaching the skin. The most commonly used bleaching agent is something called hydroquinone. Hydroquinone works by blocking an enzyme necessary for pigment production. However, hydroquinone must be used carefully and ideally under a doctor's supervision because it's very easy to overuse it, and instead of simply turning darkened areas back to their normal color, you can often notice areas becoming too light, defeating the purpose of evening out your skin tone. Other commonly used agents that can help treat hyperpigmentation and are considered much safer for everyday use are things like niacinamide, azelaic acid, and arbutin. These tend to be available in many over-the-counter products and can be used safely over longer periods of time. A second very bothersome area to experience discoloration is around the eyes. This becomes increasingly common as women get older, but it is not the result of excess pigment. Instead, what happens as we age is that the opening around our eyes start to widen and we lose collagen in the second layer of our skin. As a result, our blood vessels underneath the surface become more visible, and this is what causes the discoloration. For this reason, things like bleaching creams and other topical preparations are often ineffective. The most effective treatment for this discoloration is the injection of filler, which contains hyaluronic acid. This helps eliminate that volume loss, improving discoloration. The final area of common discoloration that I want to discuss is discoloration on the neck and underarms. Again, some people may mistake this discoloration for excess pigment, but this is not the case. This is often representative of a process called acanthosis nigricans. In this condition, the skin can take on a velvety dark appearance and can be associated with prediabetes. In severe cases, this discoloration can also appear on the chest and face. There are not very effective creams or topical medications that can help improve this discoloration, but it often can improve by diet and exercise, which can help regulate your sugar levels. So if you suspect that you may be suffering from this condition, it's really important to have your blood sugars checked on a regular basis. I hope you all found this helpful. Thanks so much for watching, and be sure to like and subscribe below. The doctors at FemHealth are here for you and your family.